Okay, I hope everything is visible, right? Shall I start? Okay. So we're done with SAR's introduction. So, like I was into in this pattern, from past 10 years, and 2026 is going to be the 11th batch, and I have seen so many interns personally, and I have interacted with them, and I personally have wasted so much of my time in exploring the things in dentistry. Okay, right. So this is basically more useful for an intern, and of course this video what we are going to upload will be definitely useful for so many of you, even if you're doing masters, even if you're doing PG, opened a clinic. So there's lots of dentistry is a very huge thing. Okay, our profession is a very huge thing. So every time we need to explore dentistry at different levels. And when I was an intern, we don't have this interactive sessions, or we don't have this social media impact or something. So our goals, our plans are very simple. It's something like, you once your final result is out, you start your internship. Okay, and you talk with the senior who is close to you. Then you start doing like whatever your senior has done, right? Mostly just copy paste the strategies of your senior, nothing more than that, because we don't have this Instagram, we don't have this impact of social media that 11 to 12 years back. So, and after a phase of time, because the only source 15 to 10 years back is the senior. You don't have proper information in the Google also. But later comes to a stage, uh, in the initial phase of this impact of social media, normally most of us immediately after final year result or after a certain level into dentistry, I feel like what is your vision is the straight away whatever you can see is a blurred vision. Means you don't know, you're going somewhere, you're directing yourself in some way, but your vision is not clear. Okay, I hope the people of those generations will definitely accept this. Then comes the next generation, the present generation, right? Everything, we don't watch a news, we don't watch anything, everything whatever, like you get the information through the social media. Okay, the most happening information will be social media, right? Do you accept this, guys? Most of the information whatever you're getting, something happened there, something happening here. Okay, this is happening, that is happening, politics wala, every stuff. Now the only source that you are getting is through social media. And even like the options after dentistry, the opportunities after dentistry, jobs opportunities, coaching centers, exams, even some sort of preparation is happening. Like reading for an exam is happening on a social media. Okay, top 10 questions. Okay, this is the easy book, that is the difficult book. We see lots of stuff in social media. And my answer for the present generation, because I have seen the lab between that 1 to 2, 2 to 3 generations, this is the most horrible generation. Okay, do you accept this? More confusions, rather than like someone who is preparing for an entrance exam, sitting on arms preparing for an entrance exam. Now you get so many suggestions. This is good, that is good, Germany is good, Africa is good, Egypt is good. So this lead to more confusions. Okay, the problem of social media on the impact of dentistry is the stuff is not being organized well. Okay, you don't have this stuff being organized. Okay, but once you find these things, organize yourself, then the social media usefulness to your life or to explore the dentistry will be more. Okay, so the present generation, the best suggestion what I can give you is, okay, you're following something social media, you're following something from the social media, you want to attain something from social media related to dentistry, make sure it should be organized well, it should be filtered well, or else it will lead to more damage, it will lead to more disadvantages than advantages. Okay, right? You see, like until unless I finish my final year, I don't have any plan that what I am going to do after my final year exams. In internship, what I need to do, I have planned after final year. Now, a first year BDS graduate or a person who is about to join into dentistry is planning everything, because everything is arranged, is available in social media, but it is arranged in the most disorganized way. Okay, so clear, you can get the information, but it has to be arranged in the organized way to be successful. Okay, that is the first thing I want to start. Now, normally people start their journey. Okay, they may take their life serious into consideration after their final year. Some people after their internship they start taking things seriously into consideration. And we have an impact, right? Past impact will be there. What is going to be the future? You have lots of confusions. Okay. Yes, definitely past is going to have an impact. Okay. Knowledge wise, or an attitude wise, or a subject wise, or something XYZ. But past will not decide your future. It will have an impact. Okay. But it will not decide your future. What you are doing present, today, what you're doing, and what you're planning for tomorrow, what you're planning for your future today, what you're planning for your future is going to cause more impact. Okay. So guys, please organize your things properly. Okay. That is the most important thing. Rather than sitting hearing 1 or 2 hours of class, what is the future and all this stuff doesn't make any sense on a larger scale. What makes a sense is you explore the levels. Okay. Dentistry is something like you explore the levels. Dentistry is a very huge, okay, world is very huge, and people are moving from India to different countries, getting settled down in the last 10 to 11 years of my teaching and all this. Like yesterday, I got a call from my old student that she has cleared ADC, Australian Dental Council, one of the toughest exam in the world. Okay, she fighted so much, and finally yesterday she cleared the exam. We are very happy. That's what I'm telling. Like, tough things are there, but opportunities are there for the people who are working hard. Okay, and she was from Sri Sai Vikarabad. Okay, long back as an intern. Work hard, ups and downs in the preparation, then cracked the entrance in the last 3-4 months. She worked so hard. She got Telangana state 5th rank. She has done MDS in pedo from GDC Hyderabad. Then she used to work. Then she got married. Then she moved to Australia. Then she had all those pregnancies and everything, all the stuff. Fighted, part 1 done, part 2 failed, again fighted. Finally, yesterday the result was out. She has cleared the exam in different levels. That's what I'm telling. Like, you may think I am nowhere related to Australia. You may think I'm nowhere related to LDS, or I'm nowhere related to ORE, or I'm nowhere related to Canada. I have my closest senior. She never have a thought of going to USA, but that's what happened. Like, topper in the state, done with MDS in Endo, used to work in the clinics, had her own clinic. Then suddenly she got married to a US based citizen. Then she moved up, cleared the exam, done with DDS, now working, now planning the upgrading. Okay, it's good to know everything. Okay, that's what my suggestion. Like, you may be preparing for an MDS exam. There's nothing wrong. You know what are the opportunities are there. Like, how you can go for UAE. You want to settle down in Gulf countries. What are the options? What are the exams? There is nothing wrong in knowing the information. So this is basically called as exploring the dentistry in an organized way. Okay, right? So my first question is, what do you know in dentistry? This knowing in dentistry is different for different individuals. It's different for different colleges. Few colleges, they have more exposure. For example, there is for example, I can give a rough example. Like, for example, a particular individual is from a good deemed college like Savita or SRM. Okay, you have Sri Balaji, so lots of good colleges there. Dentistry, what they practice is slightly different from what the dentistry is practiced in a regular colleges in the state level. One, I'm not talking about dentistry. Exposure to the dentistry, I told you, right? Exploring the dentistry. So exploring the dentistry is different. Means you have people of different ideology over there sharing their ideas. But normally, if you see a state, a particular state, a particular college, most of them, they have the same idea, that copy paste idea. Okay. So first thing is, what do you know about dentistry? Okay. That is very important. And the second one is, I want everyone who want to restart their journey in dentistry, or let it be a final year student, no problem. Let it be a third year student, no problem. Let it be a fresh intern, or let it be an intern who's done with internship. Okay. The first and foremost important thing that's going to create a great impact on you is, you start, take a white sheet, take a notes, a beautiful notes. Okay. Start writing what you know about dentistry. What do you think dentistry is? What you are good in dentistry. Like, for example, as a final year, I'm done with the final year. If you ask me what I am good, which aspect I am good in dentistry, yeah, I am good at one important aspect is, I am very good at notes making. Okay, so if you question myself, okay, being an intern, so what are good things in me? And one is notes making. A very good notes maker I am. Okay, I used to make beautiful notes where my juniors, seniors used to come. photostat that, they used to take that. Okay. So notes making is a very good quality. And talking. I talk well. Okay. I community programs, everywhere I talk well. Okay. Next, the third good quality I have, I can sit for a longer duration of time. I can sit for 5 hours, 6 hours at a stretch. I can read. And the next important thing is I got to know during my final year, okay, because my final year, I have a quota in my oral medicine radiology department that we need to address 2 seminars. And we have a quota in community dentistry. I need to address 2 seminars. Then I got to know, as my teachers are telling, your teaching skills are good. Okay. So these are my qualities. Like, what are my bad qualities is I'm very good. I'm very, very bad at hand skills. Hand skills were not up to mark according to me, like my conclusions. So now this is what exploring yourself, what you're good at dentistry, what you know about dentistry. You start writing your own story. Take a good book. Start writing about your own story in dentistry. Then whatever you know, for example, you're attending a session, you're attending a class, you're attending or watching a YouTube video, write down, yes, Australia, this is a pattern. Okay, is there anything? Now I cannot go to Australia. Yes, most of you cannot go to Australia now. Most of you cannot go to USA now. Most of you cannot go to UK now. But maybe after 10 years, you can go. As an intern, I still remember, I don't have an opportunity to dream about USA. I don't have opportunity to dream about any country. But now, after a journey of 10 to 15 years, yes, now I can go. People are going. I've seen my HODs are going. I've seen my professors are going, seniors are going. No, that's what, like, you should know something. In the future, you can dream. You cannot dream now, but in the future, once finances are settled down, once the things are settled down around you, I think you can. So a good quality is writing your own story in dentistry rather than reading other stories. There is no need to read any story. You write your own story. Take a white sheet. You know what you know in this 4 years or 5 years of dentistry. Okay, what you want to be. For example, you're exposed to so much of surgical cases and you have a passion towards surgery. Okay, I want to become a surgeon. I want to do MDS in this particular college. I want to do fellowship after my MDS. You dream, and the dream should be in this book. And this book is the one which is going to carry you to the next level. Okay, guys, do practice this. This is going to create a wonderful impact on your professional life. Trust me, this is going to work out so wonderful. Okay, clear? Clear? Shall I move to the next part? I want your response on the chat box. A quick response on the chat box. Okay, right. I'm audible, right? Clear, right? Yes, Anusha has responded. Fran has responded. Okay, right. Sharmila, right. Very good. Okay, right. So please use this. Okay, let it be. You're preparing for entrance now. Nothing wrong. You're doing a PG now. Nothing wrong. You opened a clinic, started your clinical practice, going to consultations. Nothing wrong. Start writing what you know, what you want to be, and whatever information you see something which is motivating you in dentistry. Write down. Write down that. Okay, it's not simply watching a video, hitting a like. My suggestion is write down. Write down. One day you're going to rewrite this again. One day you're going to be the updated version of many of the people who are inspiring you in dentistry. That's what I'm telling. Like, dentistry has different layers. The layer what you're exposed in your college is different. And whatever, like I hope like the mode of approach, the mode of handling will not be same for all the teachers you expose, will not be same for all the departments. So it is a layer by layer exposure will be there. So the most important aspect is you should explore the dentistry at all the levels possible. That is the most important criteria. Means even you settle down well, you have 5 or 6 branches of very beautiful clinics, you may become a HOD, okay, or you may become a principal of a college, okay, in the future, maybe probably 10, 15, 20 years from now, as most of your HODs and principals are there. Even at that level, you should have this quality of exploring. This is what I have seen from my teachers, from my HOD, from my principal. Like, they always find something new, try to learn, move here and there, learn something. I question themselves, why you're doing all this? You're done, you're settled down, you have everything you have in your life. Why you're doing this? Then I got to know this quality. Like, you should always upgrade for a better practice, for a better individual in dentistry. So dentistry is all exploring till you are in dentistry or till you are on this earth. Till you are on this earth or till you are in dentistry, you should always explore dentistry. There is no end point to learn in dentistry. There may be commas, no full stops. This is one important quality that you guys should develop. And this is a time, internship may be a time, maybe a third year or final year watching this video as a recorded version. This is a time you start exploring the layers of dentistry. Now, you learn, right? You have your beautiful book, your book of dentistry. Now, you should plan, like, I want to reach this, I want to do this. Can I make this? Sit with someone who can guide you. Let it be preparation. Let it be planning to give any sort of license exams, Australia, LDS, ORE. You're planning to give DDS, INBD, Canada license, Dubai license, Gulf licenses, whatever it is. Take a proper mentor, a positive mentor who can guide you even at the worst situation. Okay, it's not about like when you're comfortable zone, anyone can help you. When you're in the most uncomfortable zone also, select a mentor, select a senior who is going to guide you, who is going to push you, who is going to drive you through this in all the ways possible. That is very, very important. So plan accordingly, and every plan, okay, you see, like, you dreams for something, and dream should have a proper plan. Okay, so my suggestion for you guys, okay, most of your dream, I told you to write all this stuff, right? So you write all this stuff. So your dream should have a plan, and plan should have a mentor or a senior or a friend. You cannot do. Sometimes you will come to a situation where you cannot drive yourself. So you need to have some a very good mentor or senior. Senior can act as a mentor, or sometimes your friend can be a good source of mentor. So this combination is going to work out well in dentistry. Okay, you need such psychological support all the time. Okay, so goal without a plan is just a wish. So yes, you guys will wish, I know that, but what is my recommendation is, I want you to work for your goal with a beautiful plan. Okay, so that is my suggestion, guys. Okay, so like, I see, like, this is a very common thing that I encounter. I see, like, people always says dentistry is saturated. No, dentistry is not saturated. Maybe normal dentistry can be saturated, but good dentistry is not saturated. And we are in a country where the country is standing first in the world in the population. And we will never have saturation. Trust me, saturation will not be there for any sort of profession. Saturation will be there for dummy profession. Okay, I hope you can sense what dummy means. Means there may be a group of a few of your batchmates who may not be great in the work, who may not be great attending the college, who may not be not much interested in dentistry. Those are dummy professions. Means they are called as dentists, but they don't do dentistry. They don't value dentistry. So normal dentistry is saturated, but good dentistry is never saturated. Never saturation. There will be no saturation for a good dentistry. You see, like, we stay in Hyderabad, we stay in the most density area of Hyderabad. And if you just go out and just walk just for 1 kilometer, you have 10 to 15 multi-specialty hospitals are there. Not dental, I'm talking about medical wala only. So according to us, if you tell dentistry is saturated, yes, medical profession is also saturated. But last couple of days, there was an emergency and we went to the nearby hospital. We wait for almost like half an hour, 45 minutes, 1 hour for the doctor. You see, like, we are in a country where the population stands high. So there is no saturation for good things. Good things will always have demand. So my suggestion is, so the tagline for your book, for your book should be, you should become a good dentist, or you should become the best dentist in your surroundings, or you should become the best dentist in your department. You have your departments, right? Department segregation will be there. I want you to be best in that. Okay. So for that, what we should do, I have only one golden formula. Trust is directly proportional to consistency and is inversely proportional to time. Okay. Means you achieve great things in less time, people will have trust on you. You can have trust on you. And you do the same thing repeatedly over a period of time. From 10 years, you're doing root canal therapies. Yes, you have so much of trust, and I have so much of trust on you rather than a fresher. A very simple formula, a wonderful formula that's going to control your professional life. Trust is directly proportional to consistency and inversely proportional to time. So now, so what I thought is like, I don't want to at a stretch discuss everything. So like we are planning one more session, which will be upgraded on that particular group. The group link will be given in the description part of this video, which will be uploaded on the YouTube. Okay. One day, maybe one Saturday, we are planning to have a session on exclusively DDS, which will be like 40-45 minutes with question and answer session by a group of people who has cleared the exams recently, plus who has entered into dental school recently, so that you will know the recent updates or recent considerations or recent key points that will influence your selection criteria. I told you, right? I'll try to arrange one more Saturday. I'll try to arrange a call with Dr. Vaishali, who has cleared this ADS recently. I told you, right? So an inspirational, it's an inspiration for us. Okay, she will guide us for ADC. And I have Dr. Madhuri, who is going to help us in the process of this LDS, because in UK you have two exams, two pathways to clear the to start the practice. One is LDS and second one is ORE. Okay, Madhuri is going to take one Saturday. So we are planning like 3 to 4 Saturdays. And like you want to know anything about a particular license or something, like you want to out of box, you want to learn everything, make sure you try to drop on the comment section that you want to know about this, and we'll try to arrange a particular session on that. That's what, like it is going to be more organized and more informative. Okay, information should be proper. Okay, it's not like I'll do you will learn like this, you will do that, you will do this. I don't want to tell all these stories, because when something is tough or when something is of high price, when something is of high reach, it is going to be tough. Okay, reach wise it is high, but study wise or approach wise it's going to be tough. So none of these things like ADC or DDS, whatever I'm telling, they are not takeaways. You need to struggle a lot, you need to spend a lot, you need to work a lot about that. Okay, so that's what, like I'll talk about the deeper layers, telling you both advantages as well as disadvantages. I hope this is clear. So all the schedules will be shared on that particular group, both the Telegram as well as the WhatsApp groups. The links will be shared in the description part of the MDS CONQUER. So like normally you take dentistry. Dentistry is categorized into, like options are categorized into, one is domestic options, second one is international options. Let's consider it as a national wide. You want to stay in India, approach is going to be different. You want to go to other countries where dentistry is doing good, for a better lifestyle, for a better practice of dentistry. Okay, so then the approach is going to be different. But all these approaches, they decided by 3 factors. So I personally consider 3 factors. Factor number 1 is time. How much time you're going to take before you settle down. Factor number 2 is money. Time. Factor number 1 is time. Factor number 2 means how much you need to spend. The reason why I said like DDS or any of these Australia ADC or not a cup of my coffee during my internship is I'm not financially strong. My parents are ready to give time, but they are not ready to give money. Okay, so that is the reason why it was a dream for me, which I don't dare to dream also. Which I don't dare to dream. Okay, right. So the third important factor is the person who is balancing this time and money. The person who is balancing this time and money, the third factor is your parents and family. Means you may have a dream, but they may have a different dream on you. So whatever your dreams should be conveyed to them, because parents are the one who are going to provide you time. Parents are the one who are going to provide you the money. Clear? Clear, guys? So whenever you're planning or whenever you're thinking of to go to other countries to clear the license exams or extend your dentistry, these are the 3 important factors to be considered. One is time, second one is money, and third one is parents. Okay, right. Chalo, the next one is, so everything has a positive side and a negative side of the coin. Positive side means Means, for example, I'm just giving a rough example. Don't take these things into seriously consideration. For example, if I'm planning for DDS, I need to clear INBDE. Okay. So what is the pros? What is the pros? Lifestyle is a pro. So in USA, the lifestyle, the quality of lifestyle is good. One. Dentistry is good. Two. Third one, you earn more. You earn more. Okay, right? You earn more. Somewhere around like you can make 10 to 15 lakhs Indian currency per month if you're having a tag of DDS, right? Coming to the other side, okay, the disadvantages of the disadvantages in this process. What are the disadvantages in this process? It is going to take more time. Parents sometimes may not give you more time because they have some responsibilities to be done. Okay, or it take more money. You need to spend more money, and the conversion rate is less. For example, if you're planning to do MDS, if you're ready to work hard, conversion rate is more. Conversion rate is 60 to 80%. Means out of 100 people who are planning or dreaming of MDS, 60 to 80 people are achieving it. 60 to 80 people are achieving it. Conversion rate is more for MDS. Same. Now I'm talking about conversion rate for DDS. Out of 100 people who are dreaming to do DDS, okay, how many are doing DDS is somewhere around like 10 to 15% of people. Conversion rate is less. The reasons are different. That's what, like, it may be time at one point, it may be money at one point. For girls, it may be marriage at one point. Okay. So conversion rates 60 to 80 is very huge in number. 10 to 15 is very less in number. So every option, whatever you choose, has both the sides of the coin. So how you overcome this? Like, for example, few people, they have a quality, right? Yes, I want to work hard, sir. Sir, I have a quality of working hard. I'm ready to work hard. Let it be, take 10 years, no problem. From 10 years, I'll keep a target. I want to get settled down with a DDS tag in USA. This is my goal. I'm ready to give 10 years of beautiful time. Want to work hard, get settled down in dentistry, or I want to give 6 years, I want to give 5 years. So people have a criteria. So if you can fight with your criteria, then you can fall under this 10 to 15%. You try once or twice, you start quitting it, then you can fall on the other side, that is 90 to 85%. Okay, so that is what, like, for every option in the upcoming sessions, I'll be discussing about both the positive sides as well as negative sides. Then you can plan your preparation accordingly. Okay. Now, I'll be talking about very two important aspects, as Gauri sir has already mentioned. One is doing MDS. The second important criteria is there is something called as Army Dental Corps. So I'll be discussing about those two, along with the here and there we have some sort of a government job-based examination. So I'll be talking about those three exams, three categories as of now. So in India, how can we do MDS? Okay, we have two examinations. Okay, its exam is mandatory. With money, you cannot buy an MDS seat. Even if you have money, you have to write an exam. Minimum is you need to qualify the exam to buy a seat and do MDS in India. So the two gateways, one, the major gateway is NEET MDS examination. Okay, right? And the second gateway, as Sir said, is INICET MDS. INICET is including like three institutes. One is AIIMS, wherever MDS is there. Second one is PGI, and third one is GPMR. GPMR is having 2 seats. PGI is having 9 seats. Okay, AIIMS different branches are going to have different seats. That turns around like 20 to 25 seats, roughly I'm telling. Okay, so NEET MDS is going to occupy 98% of the MDS seats in the country. 98% of seats of MDS will be filled by NEET MDS examination only. So INICET occurs twice a year. One is May INICET. Second one is November INICET. NEET occurs once in a year. Preferably, it will be happening in March of every year. Okay, clear, guys? If you want to do MDS, you have two options. One is NEET. Second one is INICET. INICET happens twice a year. NEET happens once a year. Okay, NEET happens probably in the March with slight deviations here and there. INICET is going to happen twice. One is the May wala and second one is November one. Next, seats wise, throughout the country, we have somewhere around like 6,000, 6,500 MDS seats are there. Okay. And out of which 550 to 600 government dental college seats are there. Government dental college seats are free seats. And in almost all the government dental colleges, you are having stipend. They're going to give you stipend per month. Do you know what is the highest stipend in the country? Anyone? Highest stipend. Government, I don't know how many of you are from GDCs. Okay, GDC, every GDC, PG is going to have a stipend. So monthly wise, they're going to give a stipend. Any idea about the highest stipend in the country? Kirtana is telling 80K. No, not 80K. Someone is telling, yes, it is around 1,16,000. 1 lakh, 1 point, you can consider it as 1.2 lakh per month stipend is there in few colleges, central government colleges in the country. Okay, right? No, information. That's what I'm telling. Like, there's nothing wrong knowing the information. There's nothing wrong dreaming about it. There's nothing wrong planning for the dream and trying to achieve it. Okay, right? So we have 550 to 600. Okay. And the highest stands is 1,16,000 to 1,20,000 per month. I'm talking about per month. This is stipend per month from a college if you work hard, right? Which is more than a salary of a raider in your college. As a PG, maybe 1.5 years from now, if you work hard in a guided way with all the commitments, you can achieve this goal, can achieve this dream. And now I'll be talking about a very important aspect. Okay, so guys, you're from which states? Can you message me on the chat box? State, you're from which state? Yes, we have students from Andhra Pradesh, Karnataka, Tamil Nadu, Maharashtra, Kerala, Uttarakhand, Jharkhand. Any other states? Yes, Karnataka is done. Yeah, Telangana. Yes, very beautiful. Okay, very beautiful. So now this criteria is common criteria. Yes, we have students from Madhya Pradesh also. This criteria is a common criteria. So in our Telegram group as well as in our WhatsApp group that we have recently opened, we'll be sharing the information of number of private seats, number of government seats available in your state, MDS wala. I'll be telling you. But as of now, I'll be telling you, for example, I'm telling you, for example, GDC Bangalore. I'm just telling an example to make the things very simple. GDC Bangalore Endo department, for example, is having 4 seats. 4 seats are there. So all India, we have a rule which is called as 50% all India. What is this 50% of all India is telling? The 50% of all India is telling in any college in the entire country, including Jammu and Kashmir, if you have n number of seats, half of the seats will be going to 50% of all India pool. Okay, means 2 seats will be going 50% of all India pool, and 2 seats will be for the state pool. Means 2 seats will be exclusively for Karnataka students in Karnataka state counseling, and 2 seats will be going to all India pool. Means even a Karnataka student who got a good rank can get this seat. And your state seats, that is 2% state counseling, is only for Karnataka. Guys, it is clear? For example, you have GDC Indoor. GDC Indoor PDO department is having 2 seats. For example, 1 seat will be all India pool and 1 seat will be for state pool. Only Madhya Pradesh people 1 seat. In entire India, including Madhya Pradesh, everyone take 1 more seat. Clear, guys? This is very, very important. So the second thing is, sometimes there are few departments in a college, in a state, may have odd number of seats. For example, you just consider GDC Hyderabad is having 3 endo seats. So what is going to happen? They cannot split it into 1.5 and 1.5. So what they will do, 1 year, they are going to give 2 seats. The next year, they are going to give 1 seat for all India. Means whenever they give 2 seats, they use 1 seat for state pool. Whenever they give 1 seat for all India, they use 2 seats for the state pool. Guys, this is very, very important. This is very, very important. Quotas are different. Counselings will be different. Reservations are there. Lots of things will be happening in the counselings. Okay. So you should have a basic idea what is happening. Okay. So 2 questions are there. How many GDC seats are present per year in your state? This I'll be posting statewide on the Telegram group. And how many of those belongs to you? Half of those belongs to the state and half of those belongs to the national pool. Guys, clear this is? I want your quick response. Right. Right. Very good. Next important aspect is, like you see, like I was talking so much. I was talking about NEET. I was talking about INICET. I was talking about government jobs. Okay, right. I was talking about government jobs, 3 options. I was talking about there is something called as Army Dental Corps, 4 options. There are many such options in the country-wise, I mean, national-wise. And second thing is, I told you international. The most popular international options as of now are DDS in USA. You can have a license exam. Canada you can practice. ADC exam in Australia. You can write LDS or ORE in the case of your UK. And you have many sorts of license exams in different locations. So the most important thing is most of these examinations, in fact, all of these examinations, they have exams. Pakka, they are going to conduct exams. And most of these exams will move around MCQs with few here and there, like Australia, for few areas, you will be having single liners also. But most of these exams will have exams only, means MCQs only. But patterning of exam is different. Exam pattern is different. Patterns are different. Even you take INICET, pattern is different. NEET, pattern is different. Government job exams in the country, pattern is different. Okay. And sometimes the selection criteria will be different. The selection criteria is going to have reservations. The selection criteria is going to have EWS, ST, SC, OBCs. And if you come to Karnataka, people are there from Karnataka, right? People are there from Andhra. People are there from Tamil Nadu. You have reservation, subcategories. Karnataka, you have different categories. Maharashtra, you have different categories. Andhra, you have B, C, A, B, D, E. And Tamil Nadu, you have different categories, service quota. So lots of things. It means exam will be there, MCQs will be there, pattern of MCQs will be different, time duration may be different, selection criteria may be different. And most of the national examinations, I mean, most of the international examinations will have an interview also. Means selection criteria includes an interview, means not only exam, they're going to call you, they're going to make you sit, they're going to ask you some questions, they're going to judge you, and they're going to decide you whether they have to give a seat or not, right? So every exam, whenever you're planning to approach, whenever you're planning to dream, know what are these criteria, what are these patterns, what are the sources, okay? Means again, the sources will be different. INICET is not a balanced paper. NEET is a balanced paper, means NEET requires a balanced preparation. INICET is not a balanced paper. And similarly, you see, like I'm talking about ADS, or I'm talking about, for example, I'll be talking about INBD. INBD is more inclined to clinicals. Questions will be more inclined to, most of the questions will coming from the clinicals. And you take ADC or LDS, you have a different papers, like you have a basic paper, you have a clinical paper, you have a practical exam. So most of these international exams, you'll be having one more part as a practical exam, means you need to give a practical exam. So criterias, patterns, and everything are going to be different. But knowledge wise, maybe most of them, they overlap, but pattern of reading, pattern of preparation is going to slightly vary. So be clear, means a person who is preparing for NEET can also prepare for DDS, but the pattern of exam, content may be slightly okay, same, but pattern of exam or selection pattern of exam will be totally different. Guys, is it clear? You should know about this. You cannot simply open a book which you are reading for NEET or INICET, and you cannot prepare for Canada exam or Australia exam. Australia exam has a different standard books. USA has a different standard books. The mode of reading will be different for different examinations. Okay, right? That's a very, very important thing to be noted. So as I said, like people who are planning to give this session is basically for 2026 batch students. So 2026 batch students, the Karnataka students, Kerala students, MP students, and people who has recently done with their final year exams, resulted out, and they started their internship. The first exam that you are going to be eligible, which is going to be there after 13 months from now, is INICET November. INICET November is going to have 20 to 25 seats, including all the branches of AIIMS. And it's going to be for 200 MCQs. Questions will be for 200. Time duration is 3 hours. And INICET has recently changed its pattern. Means how it's like INICET is going to have 4 parts. Part A, Part B, Part C, and Part D. Each part is going to have 50 questions, total 200, and each part will be 45 minutes. Means for first 50 questions will be accessible in the first 45 minutes. Then first 50 questions will disappear after 45 minutes. Then you have access to second 50 questions for the second 45 minutes. And in the last 45 minutes, you will be having access to only last 50 questions. Guys, this is clear. Very important. Change pattern. Pattern has been changed. Long back, the pattern is different. Now the pattern is different. Okay, a very important thing to be noted. The next one is negative marking is -1/3. And the result will be in the form of percentile. What is this percentile? Okay, so you have a topper on the day of exam, right? The topper is getting, for example, for an 100 marks exam, let's consider 200 marks exam. The topper got 150 or 150 questions right. So this fellow is considered as 100 percentile. Okay. Now, for example, your score is 90 percentile, means you got 90 percentage of topper score. Percentile is how much percentage of topper score is your percentile. Guys, clear? You got right? What is percentile? INICET result will be available not in the form of marks. It is available in the form of percentile. I said like INICET exam is not a balanced paper. You don't have a balanced paper. 60 to 70% will be on the clinicals. Okay. And you will be having diagram based questions also. Okay. So this pattern slightly varies. They don't follow any blueprint. There is no blueprint that is given by AIIMS or PGI for INICET. The next exam that most of you are familiar, most of you are going to attend is, yes, of course, it is 2006. That is NEET March 2006 for people who are preparing for 2005. Exam will be in the March, slightly here and there. NBE will give you last minute twists, everything like how it has given for medicals. Okay, so it can happen. All GDC seats, all private colleges, all deemed colleges, your army dental corps, okay, and everything are included in this particular examination. The total number of questions will be 240. Time duration is 3 hours, same like AIIMS, but questions are more than AIIMS. AIIMS, INIC, you have 200 questions. Here you have 240 questions. As of now, we don't have any new modification in NEET MDS, but there was one unofficial notification that is came from NBE officially. Probably they will be releasing in this December or January about this 2025 exam. So they also have a plan of splitting the entire paper into multiple parts. Either 4, it can be 4 into 60, 240, or it can be 6 into 40, 240. Same like INIC pattern. But as of now, we don't have any official notification from this. It's wait and watch. For every right answer, you'll get +4 marks. For every wrong answer, you'll get -1. So it is 240 into 4. So this exam, your result will be in the form of marks. Guys, what is your result in the form of percentile, right? INICET, your result will be in the form of percentile. And for your NEET examination, your result will be in the form of marks. Guys, clear? Clear for now? People who are planning to restart their preparation, people who want to explore, it is very, very important. You should know what exam you are preparing for. You should know how many seats are there. You should know what are your chances. If you have reservation, what is the probability of your reservation? What are the cutoffs of your reservation, of your dream college or your dream department? You should know so that you can run in that particular direction. Okay, right? So luckily, by God's grace, NBE, who is the body conducting this NEET MDS examination, has given us a blueprint, and they're going to follow this blueprint. Each subject is going to carry 14 marks. Physio plus biochemistry 14, dental anatomy, dental histology 14, general path 7, micro 7, 14, pharmacology 14, dental materials 14, general medicine 14, surgery 14, oral path, oral microbiology 14, OMR 14, pedo 14, ortho 14, perio 14, prosto, conservative endo 7 plus 7, 14, surgery 14, and public health 14. Okay, so most of the subjects are going to carry 14 marks, which turns totally to 240 marks, which is an official blueprint that is given by NBE people, which is the organizing committee of doing these examinations. Guys, clear? Clear? Right. So what books you need to read, how you need to start your preparation, what are the things that you have to consider? All these are stepwise. It doesn't make a very great sense. You know about all these things on the day one. That is my, anyway, previously we used to take like 2.5 hours brainstorming session where we are going to saturate the brains of the students. But this time, what I thought is, let's give time, understand what you are going through, understand what your pace is at, understand what you are dreaming for, what your goal is at, what your plannings are. Okay, so with this, okay, so I'm just going to introduce my core team, faculty of mentors which are in association with MDS CONQUER. So these are a group of mentors, okay, who are going to guide us in all the ways. So what books to be done, and how you need to start reading and everything, I'll be taking as a level wise. Okay, I just want to add, I told you, right, I will be talking about NEET and INICET done, and two important aspects, both are combined, very simple. I'll be talking about, there is something called as Army Dental Corps. Okay, right, there's something called as Army Dental Corps. Any idea, guys, about Army Dental Corps? Okay, so selection criteria of Army Dental Corps is slightly different. So Army Dental Corps, basically the first important thing is you need to write NEET MDS examination. So you need to get a good rank. So followed by, once the NEET MDS exam is done, Army people are going to release a notification. So they're going to release a notification stating that a 35 or 40 posts of Army Dental Corps are open and people are open to apply for it with your NEET rank. So I have my NEET rank. So what I'm going to do is I'll be applying for, okay. So I'm going to apply for Army Dental Corps. So I'm going to apply Army Dental Corps with my NEET rank. Similarly, you have so many applications that are going to come. So many applications will be there, okay, that are going to come. So now Army Dental Corps, so they have some 35, 40 postings will be there. Posts will be there every year they have. So they are going to pick around like into 10 or sometimes into 15 they pick. Okay, for example, they have 40 posts, 40 into 10 is 400 or 40 into 15 is 600. Means 400 to 600 merit list they are going to release. Means all the students who has applied for this Army Dental Corps with a NEET rank, so they are going to categorize according to their NEET ranks and they give a separate ranks and they are going to release a cutoff of 400 to 600. So this cutoff of 400 to 600 basing upon the NEET rank is first merit list. Is first merit list of Army Dental Corps. Clear, guys, till this point? This is the first step. Means first you have to give a NEET, then the notification will be out, then you need to apply. After you apply, so they are going to release the first merit list of the top 400, 600 rankers who has applied for Army. Guys, clear? Step one. Then step two, they are going to call all these individuals. They are going to call all these individuals for the interview. Okay. So in this interview is again split it into medical part, means they're going to see the medical fitness and everything. And followed by the next one is they are going to take the personal interview, which includes both professional as well as the personal. So once your medical tests are done, your personal and professional interview is done, they again release a merit list. Merit list two. This is called as final merit list. This is a final merit list. The top 42, or basing upon the number of posts, the top 35 to 40 people who are interested in this merit list can be a part of army. Okay, so it's a gazetted post. Okay, so initially you're going to start with a 3 years service. It can be extended up to 10-13 years of service, and you have all the privileges being a part of army. And I mean, a few of you may have the passion to work with army for a few years, dedicate something to the nation and the country. So such a people can try for this. The initial pay scale ranges from 90,000 to 1 lakh, and it can go as your experience increases. And you have many sort of internal examinations basing upon your qualifications and everything. I have many of my friends, colleagues, after MDS also they're serving the country. They're doing the job over there. So I have many exams by which your stars will be increased. Okay, you have stars, right? In army, the positions will be increased. Okay, so that is one important aspect. The next important aspect is, I want to stress on the next important aspect is, there are some government job based examinations. Okay, interns are not exception to this. Interns can also get a government job. That's what I'm telling. Like, few government jobs are solidly based upon the exams only. Few government jobs, they have exams followed by an interview. Sometimes in interview we require experience. They will ask you the experience. If two people are fighting for the same position, experienced person will have an upper hand, intern may have a lower hand. Okay, so yes, you have exams. Okay, so you have PSs. Okay, PSC exams will be there. So every state is going to release, but army every year they are going to release a notification of 30 or 35 or 40, but PSC it is not mandatory. Okay, means, for example, there is a requirement of a particular government post in a particular sector or in a particular state. So most of these PSC based exams are statewide. Okay, recently there are few states who has released this. Okay, right. And as of now, to my sense, like, we don't have any PSC based exams in Karnataka zone, or in Andhra, Telangana. We don't have these exams. Okay, so recently, like, we have few exams in few states. Like, this is wait and watch. Okay, it's wait and watch. It's not mandatory. Neet, yes, every year Neet once exam is done. INICT twice exam is done. Army Dental Corps, yes, they are going to release a notification for 35 to 40 people. So they have a timeline criteria, but this is requirement based criteria. So they need to keep a bill. Once the bill is approved, then they're going to release the notification. So it's wait and watch. Okay, so as keeping goals, we can't go for an option which is wait and watch. So, but the pattern is this: like, you have an exam. So probably a few state exams they're going to conduct for 100 marks. Few state exams they're going to conduct for 200. I have seen few states conducting for 150. In few of these states, they try to include the history part also. General knowledge also will be included. Okay, mathematics and all these stuffs are not included in most of these exams, but the few states they include the history of the state. Okay, they include the history, general knowledge of the state, general knowledge of the country for 10 to 20 marks sometimes. We have the sources, we have the materials available to read for those examinations. Nothing to break your head. Once a PSC notification is coming from a particular state, and luckily you belongs to that particular state, because most of these PSC based examinations, they have domicile, they require a domicile. For example, if Bihar is releasing a notification, most of these posts will be given to Bihar domicile. Means you have to born in Bihar, or you should have any sort of connection to the Bihar, then you are eligible for this. So, I mean, criteria are different. That's what, like, I initially I told you, right? Exam patterns, selection patterns, criteria, inclusion criteria, exclusion criteria, they're slightly different from state to state. Guys, clear, right? You got some idea, right? You got some idea regarding this. So next session, that's what I told you. The next Saturday, I'll be updating you all this information on the Telegram group as well as WhatsApp group and on the Instagram page. Okay, all these links will be shared in the comment box below. Okay, so probably we'll be taking a session exclusively on DDS. It's going to take 1 hour explaining all the important aspects. Then I said like there is one more examination called as NDEB, that is for Canada. Okay, you want to move to Canada, you have a different patterning. We will be conducting a sort of live on that. Then goes for the UK. I told you UK, to start your practice, you have two options. One is ORE exam, or second one is you can go for LDS. Okay, again, ORE is having different subparts. Okay, LDS is having 3 parts, part 1, part 2, part 3. You have to clear those examinations and everything. Few are practical based, few are basics, few are clinicals. I'll be explaining you all those things. ADC, I told you, right? ADC will be taking one more session. And UAE countries and most of the Gulf countries, we will be taking a session. Okay, right? How to start the preparation is, let's start. Let's start. Okay, how to manage the time, what to be read, how an intern has to manage the time, how a housewife has to manage the time, how a repeater has to read. So it is, patterning is different. Okay, it's going to be the guidance will not be same for all. Okay, that's what, like in my 10 years of experience, what I strongly believe is guidance cannot be same for all. Guidance will be different for different individuals. Even it cannot be ideal for two individuals also. Like you need to analyze, talk, fix the goals, then you need to start working. So I strongly recommend all of you who has already started their journey for 2026 batch, or people who are attending for 2025 batch, whatever it is, like intern, first BDS, whatever, like you see this video anywhere from the source, sit and talk with someone who has a knowledge over this, then you start driving into that particular direction. Don't randomly see some YouTube video. Don't randomly do it. Okay, you see this video, make sure you get a good source, a good senior, or a good batchmate, or a good mentor, or a good teacher who has a knowledge over this. Sit with them, talk with them, plan accordingly, and make sure you take the guidance. Guidance is very, very much important to reach heights in a minimalistic time. We don't want you to reach heights after 10 years, after 15 years. Less time, more result. Okay, less time, more accurate result. The faster you grow without wasting any time is the most smartest thing that the present society has given us. Okay, you should be smart, right? The world is moving smart, and you should be smart. So I'm concluding this session. The next session probably will be announcing you on all these platforms. The links of the WhatsApp group, Telegram group, the Instagram page, and everything will be shared on the descriptive part of this video in the YouTube. Make sure you try to follow us so that you'll get more organized, layered by layered information, which is very, very important for us to be successful in dentistry. Okay, I hope this video is useful for you. Okay, take care. Bye bye. See you very, very soon. Okay, bye guys. I don't want to extend this for 2.5 hours. Okay, let's close it. Okay, I think like decent talk, decent information. Yeah, see you very, very soon. Bye. Take care.